Hi, I'm Dr. Neil Thompson from Align for Life, the Isle of Man's Family Wellness Clinic. Are you struggling with a lot of chronic low back problems and you're trying to work out what exercises can you do to try and help prevent future problems and just help manage your condition a little bit more effectively? Well, stick around for the next few minutes because I'm going to show you 4 easy exercises that are going to really help improve your balance, your strength and your flexibility, which will really help try and manage this chronic low back problem. Obviously, with all these exercises, if you're getting any pain with any of them, stop, consult whoever your local physician or chiropractor or osteopath or whoever it is, and just get them to check it out first. But these are some of the exercises that have massively helped me, and for those of you who don't know me yet, I struggled with a debilitating low back problem from the time I was 12 years old, and it was only through regular chiropractic care and doing these exercises and exercises like these that really gave me my breakthrough, and it so totally changed my life that now I don't have any problems with doing any of the exercise and sport that I love doing, and I can't recommend it enough to people who are in that same position, and that's obviously why I became a chiropractor and I do now what I do. So hopefully these will help you out. So we're going to start with just the plank. So front plank. Okay, you're just going to try and hold a nice straight spine. Keep the belly button tucked in to your spine, on your elbows, nice and straight, head forwards. Alright, see if you can work up to a minute eventually. If you can't manage that, just don't worry. Just go into your elbows and on your knees. Again, just keep a straight back. And try and just start at 10 seconds and eventually build your way up. Okay? Next thing, you want to go into a side plank. Alright, you're just going to hold that position for a full 10 seconds and see if you can build your way up to a minute as well. If you're again struggling with that, just go do a half plank, go onto your knees. And then obviously you're going to do the same the other side, like so, or alternatively like so. Alright, just trying to keep obviously your head and spine dead straight as well. So that's going to really help with the general core strength. Next one is what we call the Spider-Man exercise. So we're going to try and get opposite elbow to opposite knee, okay? Keep your back straight, head facing forwards. This is a brilliant exercise and it gets a lot of movement of the spine as well as generating a lot of balance, and also helps with your strength as well of your shoulders and your core strength. And it's when you get all that movement on the spine is what has a huge positive impact up to your brain to help dampen the stress response within the brain, and that then in turn will obviously improve your overall nervous system function and your overall health. Okay, and then you're going to do the other side as well. So you want to see if you can try and do maybe 10 on each side and build up to 20 each side. Often you'll find one side is going to be weaker than the other, and that just indicates that there's a problem there and you really need to work on trying to restore normal balance between the two sides. And often it could be because you've got a subluxation problem in the spine there that could be contributing to that. If you don't know what that is, essentially it's an interference in your nervous system that's causing the spine not to move properly and also the muscles to engage abnormally. And you want to maybe get yourself checked by a chiropractor, then he will be able to help you out with that. Okay, and then you want to go on to the next exercise, which is what we call the Superman exercise. Alright, this opposite arm, opposite leg, straight arm, straight leg, keeping your head facing forwards. This is really good if you've got an acute low back problem and you're trying to get some movement without creating too much strain on it. In particular if you've got disc injuries that aren't too severe, and at least you can get some movement without causing pain, and it gets the muscles engaged without inflaming the area. So it's particularly good if you're in an acute low back episode, but also it gets good strength in that low back and those low back muscles.